Hello, hello, hello. Alrighty. It is the first day of AP, and so our insulin costs are rising, right? They're rising, and so many people are having to choose between do I take my insulin, do I purchase my insulin, or do I purchase food? And so if you're Medicare eligible and take insulin, stay tuned. You will really benefit from what I'm going to discuss here today in this live this evening. And so my name is Katrice-Daniels. I am a licensed health insurance broker. I am licensed in 9 states, and I am also the founder of INSURE Black America, where my mission is to close the coverage gap in healthcare for Black Americans, between Black Americans and other racial groups. Okay. And so, in today's live, I'm going to be talking about the $35 Medicare insulin cap. Now, I'm sure, if you watch the news, you've seen on the news with President Trump saying that, he's made insulin as cheap as water, whatever that means. And, which, don't get me wrong, $35 for insulin is great because insulin is expensive. My dad was a diabetic. My aunt's diabetic. My niece is a diabetic. And so I know firsthand how expensive insulin is. And so this is a great benefit. However, you need to understand, today I'm going to make sure that we all understand exactly what all this $35 cap entails. Okay, so Medicare covers about 46 million people, or 15% of the U.S. population. Okay, now CMS, which is the Centers for Medicare and Medicaid Services, says that 1 in 3 Medicare beneficiaries have diabetes, and more than 3.3 million Medicare beneficiaries use at least one type of insulin. Okay, so some people use the long acting, and some people use just long. Some people use just the short. Some people use both long and short. Okay, and so while $35 is great for some, it does come with some limitations that you will want to consider. Okay, so the first thing you want to look at is take into consideration if you're on insulin and you're looking to change your plan. One is the higher premiums. Okay, now with the enhanced plans on the Part D's, some of the premiums have almost doubled that of the basic plans in the area on those same plans. The premiums have almost doubled. Okay. And they're expected to that they may continue to rise, year over year. And so that would offset that cost for the manufacturers, but they're still passing the savings on to you. And so it may cut into, not passing the savings, they're cutting into the savings if they keep rising the price of the premiums. So you want to watch out for that. That's something that you're going to have to watch out for. Now, the new insulin payment model is not available to Medicare beneficiaries who are already receiving the low income subsidy. Now, that is the low income subsidy. That is the extra help that a lot of people get with their prescription drug costs, and you apply for that with Social Security Administration. You can go to ssa.gov to apply for that. And just click on the part where it says extra help, and you can do the application online. Or if your Social Security office is open in your area, you can go down to your Social Security office and request application there, or you can also call Social Security and request the application from Social Security over the phone. Now, this new insulin model does not address the issue of non-medical switching. Okay, and so basically what that means is that there's a list of insulins that will be included in this $35 cap. Okay, if your insulin is not one of the insulins that's included and you decide to get on one of these plans, you're going to have to either switch to one of the insulins that are covered for $35, or you can stay on the insulin that you have. You'll just pay, whatever the price it is for whatever tier that it falls on the plan that you choose. Now, this is not exclusive to just the Part D prescription drug plans. There are some Part C's that have the formularies have been enhanced on the drug part to include the $35 insulin model. And the last thing is that this savings only applies to people who have Medicare. Okay, so if you don't have Medicare, then it doesn't apply to you. So I'm going to recap. One, there are higher premiums with this new $35 insulin Medicare price cap. That's a lot to say. The premiums are going up on the Part D plans that are enhanced. Some of the Part C's could very well have too. I haven't seen any, but I haven't been into all the carrier sites yet and looked at them. But they very well could go up. So you do have to keep that in mind. Also, if you are already receiving low income subsidy, so if you're already getting help from the government with paying for your medications, then you don't qualify for this program. And if the insulin that you are taking, if that insulin is not one of the insulins that's covered under the $35 model, you will either have to switch to insulin that is covered, or you can stay on what you have, and you'll just have to pay whatever the price is on with your plan. And then the last thing is that the savings only applies to people with Medicare. So if you are not eligible for Medicare, this savings does not apply to you, and so you're going to have to pay whatever it is you normally pay through your insurance when you get your prescriptions. And so if anybody has any questions or comments, you can post your comments here on the video. I will if you do it, if you're watching it on the replay, just put #replay and then post your comments, and I will come back and answer your comments. But yeah, that's pretty much it. I mean, I think it's a great start in the right direction for people with diabetes, especially our seniors, those who are looking to where they have to either, do I choose food or do I choose my medicine. I remember my grandma back in the day before she passed, she used to talk about that a lot. My medicine keep going up. Do I need to choose? Do I choose to take medicine to live, or do I choose food so I can live? So I do think this is a step in the right direction. If you are on Medicare and you have not done a health needs assessment, meaning that you have not sat down and looked at your needs, looked at what's been going on with you here this month, and then compare that to your plan and what your plan pays, and see if that's going to cover you going forward into 2021. You want to do a health needs assessment, and if you where can they go to get the list? I'm going to get a list together. I'm going to get a list of all of the insulins, and then I'll have it, and I'll post it on the page, the list of the insulins that are $35. Yeah, I'll get it. And thank you for sharing. Thank you for sharing. So if you have not done a health needs assessment, if you need a health needs assessment, or if you have questions and you just want to, talk, you can go to INSUREBlackAmerica.com, and you can fill out the form, and I will get in. Oh, you're welcome. I will get in contact with you, and then we can go over your needs, your healthcare needs. We can take a look at what your current insurance is, and compare the two. And if you need to make changes, then I'll be helping you to make those changes and get you ready for 2021. And so if you guys, if you haven't liked If you like Insure Black America, the page, go ahead, like Insure Black America. This will be uploaded to YouTube. So if you have not subscribe to the YouTube channel, Insure Black America is on YouTube. You can go to YouTube, just type in Insure Black America, it'll come up, and then you can subscribe and press the bell so that you can get notifications whenever I upload a new video. And so I want to thank everyone that watched live and also everyone who will be watching the replay. I want you guys to have a great rest of your evening, and remember that together we can close the coverage gap in healthcare for Black America. You guys stay safe.